Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bisht, BDS by degree and a pharma professional. As a founder of CareerInPharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey.
Hello everyone, once again I welcome you all to CareerInPharma. Now this is another episode in the series of important interview question for pharmacovigilance, and in today's video we are going to discuss WHO UMC, that is World Health Organization Uppsala Monitoring Center, that is the WHO UMC assessment, causality assessment scale we are going to talk about. Now, in the last video in the same pharmacovigilance important interview series, we discussed what is causality, what is causality assessment, what are different causality assessment scales available to assess the causality, to find out the relationship between the suspected drug and the suspected event. Yes. Now, today we are going to talk about WHO UMC causality assessment category. Now let me tell you, this is one of the important interview question if you are going to give interview for pharmacovigilance fresher role. Even for experienced position, this is going to one of the important interview questions. And there are 6 categories inside this WHO UMC causality categories. Now in this video, I will discuss only 3, and in the next video, you can find out another 3 scales. So just stay updated and subscribe to our channel so that you can get notification for the same. So this is WHO UMC causality categories part 1, and in part 2 we are going to discuss the remaining 3. So again, this is one of the important interview questions, so please listen this video till the end. Watch this video till the end so that you can get clarity over this skills. And trust me guys, the kind of explanation I'm going to give you regarding this skills, you won't find it anywhere, and I want to make it very super clear for you so that you don't get any confusion while giving interview. So there are total 6 categories in this WHO UMC causality category. So first category is certain. Category number 2 is probable, which is also known as likely. Category number 3, we call it as possible. Category number 4 is unlikely. Category number 5 is unclassified or conditional. And category number 6 is unclassifiable or unaccessible. So these are 6 categories inside this WHO UMC causality assessment scale. And today in this video, we are going to talk about category number 1 certain, category number 2 probable, and category number 3 possible. And I'm going to explain these categories with examples to all of you. Yes? So let's begin these categories one by one. So category number 1 is certain. See, in a very layman term, certain means pakka, right? Means agar aap kisi cheez ke liye bahut sure hain, so that is certain, right? So in this category 1, certain, when your answer is completely yes, means the patient report which you are getting, in that report all the information is available, and the report clear cut stating that the adverse event is happened because of the drug only. All the re-challenge information is supportive to your conclusion of that the adverse event is happened because of the drug only. In this category, we call it as certain. So if all the information is positive, all the information available in the report, and you can say certain, you can say pakka ki this adverse event is because of the drug only, then it will fall under the category of certain. Now here, what are the assessment criteria? You need to check the possible time relationship to the drug intake, meaning when the adverse event happened, when the and when the drug is taken by the patient. Okay, so let's say immediately after taking the drug, if the adverse event has happened, that is, there is a plausible time relationship between the suspected drug and the suspected event. Okay, and if through the report, if that adverse event cannot be explained by any other disease or drugs, it means patient is not having any concurrent illness, patient is not having any other drug history or surgical history, patient is not taking any other concomitant medicine, there is no concurrent illness present in the patient, and even if it's present, there is no relationship between the suspected drug and the concurrent illness on the concomitant medication. Third criteria is D challenge is positive, means in the report it has been mentioned that after taking the drug the patient had some XYZ event, and when the patient stopped the drug, the XYZ event also resolved. So this is a positive D challenge, means by the report you can say that D challenge was there and it was positive. Yes, and also where you can define the adverse event pharmacologically, means the adverse event we can justify that it is because of the class of the drug, because of the mechanism of action of the drug, means the pharmacological property of the drug can justify that the adverse event happened because of this. Okay, that information is also there, then you can say certain. And also the re-challenge is also positive. Yes, means where after having the positive re-challenge, let's say in the report it is given that the patient took the medicine again, and after taking the medicine again there was the same adverse event. So it means the re-challenge is also positive. So you can say in this category of certain, that is 100% pakka, in this everything is in favor of concluding that the adverse event happened because of that product only which you are suspecting. Okay, so there is a plausible time relationship between the drug and the event. There is no other factor such as concurrent illness, concomitant medications. D challenge is also positive, re challenge is also positive, and we can justify the adverse event to be pharmacologically related to the drug. Okay, because of the class of the drug, because of the mechanism of the drug, that thing is happening. So that then in that case we will keep that adverse event in the category of certain. Now I would like to give you one example. Okay, now example is also, I am giving you one example, and the same example I will connect you in other categories as well, so that you can able to understand. Okay, now I am giving you one example. Let's say any patient is in DOTS therapy, right? You all know DOTS is a therapy which we give to tuberculosis patient. Let's say a patient is on DOTS therapy with isoniazid, rifampicin and pyrazinamide, and after some time of DOTS therapy, the patient was diagnosed with hepatitis and the doctor advised to stop all the medicines. And after stopping the medicine, stopping medicine means we are doing the D challenge. Yes, and after stopping all the drugs, doctors observed that hepatitis also resolved. So in this case, D challenge is positive, event resolved completely after stopping the drug. Then doctor told the patient to retake isoniazid. Yes, but just taking by isoniazid, hepatitis did not occur. Then the doctor told to retake rifampicin, but again hepatitis did not occur. And at last, just to verify, the doctor told the patient to take pyrazinamide also. Now this time the symptoms of hepatitis started to reoccur. Yes, so it means re-challenge is also positive. Yes, because after starting the drug again, the event of hepatitis happened. Now here we all know with DOTS therapy, the mechanism of action of these drugs are like that they're going to affect the liver. So it is pharmacologically also defined. Here in this example, D challenge is also positive. Here in this example, re challenge is also positive, and there is no other disease present in this patient as per the report which can which you can doubt in the direction of hepatitis. And there is a time relationship also, means after taking this dot therapy only, the patient is encountering hepatitis, and then re-challenge also positive, re-challenge also positive. The mechanism of action of dot therapy is like that, which affects livers. So pharmacologically defined event, and that is an example of certain category. Yes. So just to summarize the category certain, where you are 100% sure, where the report is complete, where you do not need any additional information, where you do not need any additional follow-up. By the initial report, you can say that this is short because of the drug. And now this is one of the example which I gave is for certain. Now let me tell you, in practical scenarios, like when you do the job, very rare cases you will get reports like certain, because always practically sometimes there will be something missing in the initial report, and then we do the follow-up, and then only we can say and finally conclude. So yeah, just for understanding purpose, there is a category called certain also, but practically in reality in job, these kind of certain scenario you will find rarely, because to say anything certainly, to say anything with confidence, you need to have full information in the initial report itself, right? This is the category called certain. Now there is a second category which is probable. Okay, now if I find the difference between, layman terms, certain means pakka and probable means anything whose certainty is less than 100%. What does it mean? See, if it's 100%, it means certain. Okay, everything is in support that adverse event happened because of the drug. But probable is also kind of positive, but it's not 100%. Okay, so where certainty is less than 100%, then it will be probable, means it may happen because of the drug. Chances are there, but there is something missing in the report because of which we can't say that it is certain. Then it is a probable. Okay, not 100%. Okay, it means where your answer is yes, but some information is there which is not there, and because of which we can't say it is, we can't classify it as certain, and we have to keep it in the category of probable. Now might be that if when you order some follow-up information, when you ask for some follow-up information, after follow-up information you can say it as a certain, but at present, at this moment, whatever information I have by going through the report, there is something missing which allows me to keep this adverse event in the category of probable, that is likely. So here your answer is yes, positive only, but some information is not there. So let's see what is the criteria for this category of probable. So first of all, possible time relationship to drug intake, as we saw in certain. Second thing is cannot be explained by disease or any other drugs, no concurrent illness, no concomitant medication, like we saw in certain. Response to withdrawal possible, means de-challenge is possible, like what we saw in certain. Adverse event also pharmacologically defined, like we saw in certain, but here re-challenge information is not provided. Okay, so all these information were positive in certain, but in probable all the information is there, but re-challenge information is not there, where we can make sure that it falls in the category of certain. So one factor is missing, one criteria is not there, criteria information is not there. That's why we are keeping this adverse event in the category of probable, means we are not 100% certain, but yes, if we get the re-challenge information in the follow-up information at that time, we can keep it in the category of certain. Now I'm going to give an example for this probable or likely category also. So for example, a 60-year-old male patient is diagnosed with benign prostatic BPH. Okay, so BPH is prostate enlargement, BPH is benign prostatic hyperplasia, where prostatic gland enlarged. Okay, so that is BPH. So let's say if a 60-year-old male patient is diagnosed with BPH and doctor prescribed him prazosin and finasteride. So that is the treatment for BPH. So doctor prescribed prazosin and finasteride, and after some time of taking this medicine, the patient felt dizziness. Then the patient felt dizziness and patient went to doctor again. Okay, and after going to the doctor, the patient was diagnosed with postural hypotension. Postural hypotension. And we all know that with prazosin, there is a very common side effect, which is because of the pharmacological effect of prazosin, that is postural hypotension. So doctor replaced prazosin with tamsulosin, and then postural hypotension resolved. Okay, so here you can see that this postural hypotension, which was happening in the patient because of prazosin. Yes, but doctors also prescribe finasteride along with prazosin, right? So after this feeling of dizziness and postural hypotension, the doctor stopped prazosin and replaced prazosin with tamsulosin, and then postural hypotension resolved. So D challenge is positive and patient was feeling better. Now the doctor further advised the patient to continue with tamsulosin and finasteride, and there was no re-challenge information. Means here doctor replaced prazosin with tamsulosin. Okay, D-challenge information is there, but doctor never re-prescribed prazosin, right? They never started prazosin again. So here we don't have re-challenge information. So that's why this category is probable. Not 100% certain, not 100% pakka, but probable. Okay, because we don't have re-challenge information. So all the factors, criteria, they are as per the example. Means there is a time relationship between taking prazosin and postural hypotension. There is no other disease, no other concurrent illness, concomitant medication. D challenge was also positive. Prazosin stopped, postural hypotension resolved. And prazosin mechanism of action is like that. It causes hypotension, postural hypotension, right? So adverse event here, that is adverse event is postural hypotension. So that is also pharmacologically defined in this example, but re-challenge information is not there. Means doctor did not re-prescribe prazosin. So that's why it falls under the category of probable. Now third category is possible. Now if you ask me the difference between the probable and possible, then I would say that, see, probable means likely to happen, okay, and it's true but not certain, that is probable. Yes, but possible means that something will happen, okay, but it did not happen. Means it is very likely to happen but not sure if it happened because of that only or not. Okay, so you can say the difference which is there between certain and probable, the same difference is there between probable and possible. Now let's understand what are the assessment criteria. So in possible, there could be possibility that because of interaction with some other drugs, or there is some drug disease interaction might be. Okay, so there is some third person coming in between. So because of this, we are putting this into possible category. Okay, now here assessment criteria, it's same like possible time relationship between the drug intake. Now here in this assessment criteria for possible, here we can explain this with the help of some other disease or some other drug. Means there is some concurrent illness in the patient or some concomitant medication the patient is taking, because of which we are putting this into possible. Adverse event pharmacology defined, that is fine. D challenge is positive. Re-challenge information not provided. Okay, and here also data is inconclusive. Okay, we can't conclude anything. To make the data conclusive, we need follow-up information. So data is inconclusive. Now example, in the same DOTS example which I gave you, DOTS therapy example which I gave you for certain category, I taking the same example. Now a patient is on DOTS therapy with isoniazid, rifampicin, pyrazinamide. After some time DOTS therapy, the patient was diagnosed with hepatitis. and the doctors advised to stop all the medicines, and after stopping the drug, hepatitis resolved. Now what is the thing here? Here, first of all, we don't have re-challenge information, although de-challenge information is there, okay? But here the data is not complete, okay? Means the de-challenge is positive, there is a plausible time relationship between the drug and the event. It can be explained by disease or other drugs, okay? Can be explained by disease or other drugs means here we don't have data, but we can define this pharmacologically. Means we all know that with the help with this DOTS therapy, there are many things happens inside liver. So hepatitis is pharmacologically defined because of this DOTS therapy. Okay, but we don't have complete data. Re-challenge information is not there. So that's why we are putting this into category 3, that is possible. Means possibility is there that because of this DOTS therapy only hepatitis has happened, but as we don't have complete data, so that's why this data is inconclusive and we are putting it in the category number 3, that is possible. See, with this given information which I told you in this example, we don't put this into certain, because certain means 100% pakka. We can't keep it into probable also, because for probable also all the criteria should be fulfilled except one. So only thing is remaining is possible. Yes, that's why here this example falls in the category of possible. Yes. So now I hope you all got clarity over these 3 categories: certain, probable, possible. Okay, so certain means 100% guarantee. Probable means likely, not 100%, but yes, likely. So only one factor is missing. Third is possible. Impossible means yes, it could be because of the drug, but as we don't have complete information now, data is inconclusive, so we'll ask for follow-up information. Yes, so these were the 3 categories with their examples, and I hope these examples gave you clarity on these categories, and I hope these categories are clear to you now, and I hope through these examples, through the way I simplified this, you will be able to answer these categories with full confidence in your interview also. Okay. So one thing is very important to understand in pharmacovigilance is, unless and until we don't have complete information, we can't put any category into certain. That is for sure. Okay. Otherwise, we always have mix of reactions like probable, possible, unlikely, unclassifiable, and unaccessible. Those categories are there, but you know, for these 3 categories, what things you need to look, that I have clarified, and I hope through this video you got clarity over these categories: certain, probable, possible, and I will be explaining the remaining 3 categories of WHO UMC assessment scale in the next video along with examples. And if you really like this explanation, if you really found this explanation simple, then please don't forget to subscribe to our channel. Don't forget to hit a like button, and don't forget to share this channel with your friends who are preparing for pharmacovigilance interview at a fresher level. Yes. So yeah, this is all about this video, and in the next video, that is part 2 of WHO UMC assessment causality assessment scale, I will explain the rest 3 categories. Yes. So till the time I come again, till that time, please stay safe, aware, healthy, updated, and keep exploring new things. And please subscribe to our channel so that you can get notification when I am back with WHO UMC assessment scale part 2. Yes. So this is all about this WHO UMC assessment scale 3 categories. Further 3 categories in the next video we are going to cover. So till the time I come again, till that time, have a nice day. Bye bye, and once again, bye bye all of you.